Welcome to Study Session 10, Testing in Clinical Psychology. Introduction. Psychological testing was primarily and basically the function of the clinical psychologist. More recently, because of the clinical psychologist is seen to do or conduct psychotherapy and research, behavioral therapists have frowned at the use of psychological tests within the field of clinical psychology. Despite this, clinical psychologists cannot function at all without making use of some psychological tests. In this study session, you will be introduced to psychological tests, different objective and projective tests, and the uses of psychological tests. Learning outcomes for study session. At the end of this study session, you should be able to 1. Define psychological tests. 2. Explain different types of psychological tests. 3. State the uses of psychological tests. The definition of psychological tests. Claremont, 1979, defined psychological tests as a standardized instrument or systematic procedure designed to obtain an objective measure of a sample behavior. By standardized, it is meant that the test should be of such a nature that it presented. Take 2. By standardized, it is meant that the test should be such a nature that it is presented in an identical fashion to all subjects. An objective measure is a score which is arrived at by adding up certain clearly specified response characteristics in a manner which precludes any bias from the assessor. The sample of behavior implies the notion of representativeness. Clearly, it is impossible to record everything a person says, thinks, and feels in many different life situations. A psychological test is essentially an objective and standardized measure of the same behavior. The key concepts in the definition are standardized, objective, and sample behavior. Types of psychological tests. Psychological tests can be broadly classified into 2, which are listed in the diagram below. Objective test, projective test. 1. Objective psychological tests. Objective tests are very structured questionnaires involving multiple choice and or true or false questions. They are self-report questionnaires in which a person is required to respond to items that are indicative of habitual tendencies that may or not apply to the respondent. When these tests are developed, they are typically administered to many people to analyze how certain kinds of people tend to respond so as to establish statistical norms for the test that can serve as the basis for comparison of scores on the test. This process is called standardization. Objective tests limit the range of response available to respondents, making it possible to only respond based on the provided format. Because scoring is very straightforward and each answer receives a certain amount of points based on a point scale, objective tests are a lot more valid and reliable than projective tests. However, a major downfall to objective tests is that people can lie and fake their answers. An individual could easily check off all the desirable answers containing traits that they wish they had to make them look like a better person. Good examples of objective psychological tests are self-report personality inventories such as the Minnesota Multiphasic Personality Inventory 2, MMPI-2, the Million Clinical Multi-Axial Inventory 3, MCMI-3, the 16 Personality Factor Questionnaire, 16PF, and intelligence tests such as Wisher Adult Intelligence Scale, Minnesota Multiphasic Personality Inventory 2, made up of 576 true or false tests in a good measure of dysfunction within personality. It is less useful as a measure of healthy or positive personality traits because its design was based on helping a professional to find a psychiatric diagnostic label that best suited an individual. Originally developed in the 1940s, it was significantly revised in 1989 and had another minor revision in 2001. The NMP1, Take 2, the NMPI2 measures personality traits such as paranoia, hypomania, social introversion, masculinity, femininity, and psychopathology, among others. It does this by connecting an individual's responses to dozens of questions scattered throughout the test that are positively or negatively correlated with a particular personality trait. Because the questions are not always obviously related to the traits to which they are correlated, it is difficult to fake this test. The NMPI2 is most often self-administered on a computer in a clinician's office in technologically advanced societies, but it's also available in the paper and pencil format. The Milling Clinical Multi-Axial Inventory 3 MCMI3 is specifically used to arrive at a DSM-4 personality disorder diagnosis. Because it takes only a third of the time to take as the MMPI2, it is often preferred when a simple assessment of an individual's personality disorder is needed. There would be a need to revise this test to align with the current DSM-5 specifications for the diagnosis of different disorders. Because the MMPI2 is not an ideal measure for people with healthy personalities, other measures such as 16pf may be more appropriate. The 16pf measures 16 basic personality traits and can help a person better understand where their personality falls among those traits. 1. Warmth, reserved versus warm, factor A. 2. Reasoning, concrete versus abstract, factor B. 3. Emotional stability, reactive versus emotionally stable, factor C. Dominance, differential or dominant, factor E. Liveliness, serious versus lively, factor F. 6. Rule consciousness, expedient versus rule conscious, factor G. 7. Social boldness, shy versus socially bold, factor H. 8. Sensitivity, utilitarian versus sensitive, factor I. 9. Vigilance, trusting versus vigilant, factor L. Abstractedness, grounded versus abstracted, factor N. 11. Privateness, forthright versus private, factor N. 12. Apprehension, self-assured versus apprehensive, factor O. 13. Openness to change, traditional versus open to change, factor Q. 14. Self-reliance, group-oriented versus self-reliant, factor Q2. 15. Perfectionism, tolerate disorder versus perfectionistic, factor Q3. 16. Tension, relaxed versus tense, factor Q4. 2. Projective psychological tests. Projective psychological tests involve questions that are open-ended and relatively unstructured, which allows the person being tested to have more freedom to respond as desired. The use of projective tests assumes that the respondent would be either unable or unwilling to express his or her true feelings if asked directly. Freud's work on the presence and influence of unconscious processes in psychological disorders no doubt contributed to the development of projective tests. These tests include a variety of methods in which ambiguous stimuli, such as pictures of people or things, are presented to a person who is asked to describe what he or she sees. The task presented thus often permits an almost unlimited variety of possible responses. The basic assumption here is that people project their own personality and unconscious fears onto other people and or objects, in this case the ambiguous stimuli, and without realizing it, reveal their unconscious thought to the therapist. Projective tests include the Rorschach in-block test, the thematic apperception test, complete a story or sentence test, and the draw a person test. In-block tests are a major example of projective tests. These tests are highly unstructured, and the responses and outcomes take two. These tests are highly unstructured, and the responses and outcomes can be determined and interpreted in various ways. Responses are scored based on what shape is seen on the in-plot, as well as what pattern or theme is noticeable in the individual's choices. The Rorschach in-block test is perhaps the best known projective technique. In the test, a person is shown 10 in-blocks, one at a time, and asked to tell what the blocks look like. Half the in-blocks are in black, white, and shades of gray. 2 also have red splotches, and 3 are in pastel colors. Exner 1978 designed the most commonly used system for scoring the Rorschach test. The Exner scoring system concentrates on the perceptual and cognitive patterns in a person's responses, derived from the location described in the in-block and the things in that plot that prompted the person's response. Rorschach suggested this approach to scoring in his original manual, Psychodiagnostics, a diagnostic test based on perception, 1921. But he died at the age of 38, only 8 months after publishing his 10 in-blocks, and his immediate followers devised other methods of interpreting the test. The Exner scoring system has norms, although the system on which they are based was rather small and did not represent different ethnicities and cultures well. The thematic apperception test, TAT, is comprised of 31 cards that depict people in a variety of situations. A few contain only objects, and 1 card is completely blank. Often, only a small subset of the cards is given, such as 10 or 20. The person viewing the card is asked to make up a story about what he or she sees. The TAT is not often formally scored because it is designed to tease out recurring themes in a person's life. The stories that are created are analyzed based on the themes that occur, which help to identify an individual's personality as well as the pressures that they face and what each person needs internally. The pictures themselves have no inherent or correct story. Therefore, anything a person says about the picture may be an unconscious reflection in the person's life or inner turmoil. Interpreting the stories told by the client or patient is often subjective and depends on the therapist's frame of reference as well as what the patient may say. This has led to little reliability across raters using the TAT, and doubts remain about its use in psychopathology. The construct validity of the TAT is also limited. There are several different other ways of classifying the projective techniques, and schemes have been proposed by Lindsay, 1959, and based on the type of response elicited, which are listed below. Characteristics of projective tests. 1. Association techniques. The subject responds to a stimulus with a word, an image, or a precept. Example, the word association test and the Rorschach. 2. Construction techniques. The response is a product of a complex cognitive or constructive activity. For instance, the subject may make up a story about a picture. Example, the thematic apperception test, TAT. 3. Completion techniques. The subject is asked to complete some incomplete stimulus, such as a sentence root or the beginning of a story. Example, Rota incomplete sentence blanks. 4. Choice or ordering techniques. A number of alternative stimuli are presented. The subject is asked to choose one or more of these alternatives on the basis of preference or arrange them in some defined sequential order. Example, picture arrangement test. 5. Expressive techniques. Examples, drawing and painting techniques and psychodrama. Intelligence test. The intelligence quotient, IQ, is a theoretical construct of a measure of general intelligence. It is important to note that IQ tests do not measure actual intelligence, but rather they measure what is believed to be probable important components of intelligence. IQ tests are based on the assumption that a detailed sample of a person's current intellectual functioning can predict how well he or she will perform in school, and most are individually administered. Alfred Binet, a French psychologist, originally constructed tests to help the Parisian school board predict which children were in need of special schooling. The two primary measures used to test a person's intellectual functioning are intelligence tests and neuropsychological assessment. Neuropsychological assessment, which can take up to 2 days to administer, is a very extensive form of assessment. It is focused not just on testing for intelligence, but also on determining all of the cognitive strengths and deficits of a person. Neuropsychological assessment is most usually done with people who have suffered some sort of brain damage, dysfunction, or some kind of organic brain problem, just as having a brain hemorrhage. Intelligence tests are the more common type administered. Intelligence testing has since developed into one of the largest psychological industries. The most commonly administered tests include the Wechsler Adult Intelligence Scale, 4th edition, the Wechsler Intelligence Scale for Children, 4th edition, the Wechsler Preschool and Primary Scale of Intelligence, 3rd edition, and the Stanford Binet, 5th edition. IQ tests are regularly updated, and like personality inventories, they are standardized. The most commonly administered of these tests is the WAIS-4, which generally takes anywhere from an hour to an hour and a half to administer, and is appropriate for any individual aged 16 or older. To take the WAIS-4 is divided into 4 major scales to arrive at what's called a full-scale IQ. Each scale is further divided into a number of mandatory and optional, also called supplemental, subtests. The mandatory subtests are necessary to arrive at a person's full-scale IQ. The supplemental subtests provide additional valuable information about a person's cognitive abilities. The 4 major scales and subtests of intelligence tests. 1. Verbal comprehension scale. Similarities, vocabulary, information, and supplemental subtests. Comprehension. 2. Perceptual reasoning scale. Block design, matrix reasoning, visual puzzle, and supplemental subtests. Picture completion, figure weights, 16 to 69 only. 3. Working memory scale, digit span, arithmetic, supplemental subtests, Letter number sequencing, 16 to 69 only. 4. Processing speed scale. Symbol search, coding, supplemental subtest, cancellation, 16 to 69 only. Beyond predicting school performance, intelligence tests are also used in conjunction with achievement tests to diagnose learning disorders and to identify areas of strength and weaknesses for academic planning. They also help in determining whether a person has intellectual developmental disorder, formerly known as mental retardation, and to identify intellectual gifted children so that appropriate instruction can be provided for them in school. Uses of psychological testing. Psychological testing can be found useful in the following areas listed below. 1. Screening. 2. Predicting success of therapy. 3. Detecting individual differences. 4. Diagnostic formulations. 5. Classification and placement. 6. Enhancing self-understanding. 7. Program evaluation. 8. Performing scientific inquiry or research. 1. Screening. One of the principal functions of tests for the clinical or counseling psychologist is as rough screen for pathology. By giving a brief test battery at an appropriate spot early in the process, the clinical psychologist can get a clearer picture of the likely issues to be faced later. Severe pathology often does not show up until later interviews. By giving a projective technique or the MMPI, the psychologist often can obtain a clearer understanding of current or more obscure pathology. Similarly, on intellectual variables, the psychologist often desires a quick estimate of the client's intellectual capacity and functioning in advance of more definitive data. Therefore, a short vocabulary test such as the Wechsler Adult Scale Vocabulary Test can give such data. 2. Predicting success of therapy. Psychological tests can provide information regarding readiness for counseling. Research studies support the statement that the rapidity of achieving successful counseling outcomes hinges on ego strength factors such as response adaptability, capacity to test demands of reality, and undistorted perception. Therefore, the clinical psychologist can decide early in the process whether continued counseling with a client will be feasible or desirable. 3. Detecting individual differences. A psychological test is used to measure the individual differences which are different between abilities of different persons and the performance of the same person at different times. 4. Diagnostic formulations. The psychological tests are usually used in clinical psychology to diagnose mental disorders. Pinpointing pathological types has been and continues to be a major fault of the clinical psychologist. Projective techniques such as the Rorschach and thematic apperception tests have been used along with tests such as Wechsler's Adult Intelligence Scale to give a rounded picture of the perceptual, conceptual, and affective functioning of the client. 5. Classification and placement. A psychological test helps in classifying a number of people into different categories so that they can be appropriately placed into training programs or positions of service that best suits their ability, potential, interest, or personality. Psychological tests are helpful in selection and classifying personnel for placement in jobs that range from simpler semi-skilled to the highly skilled, from the selection of filling clerks and salespersons to top management for any of these positions. However, test results are only one source of information, though an important one. People could be classified into normal and abnormal, criminal and innocent, intelligent and mentally retarded, able and disabled, fit and unfit, and so on. 6. Enhancing self-understanding. A psychological test provides standardized information about the abilities, capabilities, aptitudes, potentials, competences, interests, traits, and states of a person, which helps in understanding one's personality and planning future prospects. 7. Program evaluation. The effectiveness of a particular program or intervention is usually assessed by applying some kind of achievement test to ascertain if the goal of a program has been attained. 8. Performing scientific inquiry or research. Some clinical psychologists use tests for research purposes to make available information about the mental, emotional, and/or personality traits of a particular person or a group of people. Summary of study session. In this study session, you have learned that 1. Kleinmont, 1974, defines psychological tests as a standardized instrument or systematic procedure designed to obtain an objective measure of a sample of behavior. 2. An objective measure is a score which is arrived at by adding up certain clearly specified response characteristics in a manner which precludes any bias from the assessor. 3. Objective tests are very structured questionnaires involving multiple choice and/or true or false questions. 4. Screening is the one of the principal functions of tests for the clinical or counseling psychologist is as a rough screen for pathology. This is the end of study session 10. Thanks for listening.